We're here in sunny Barcelona, and today I'm with Farhad Hafezi, a professor of ophthalmology at the University of Geneva. Farhad, I'd like to talk about excellence. So you opened the ELZA Institute in Zurich earlier this year. It's a state-of-the-art Swiss centre of excellence in ophthalmology that was built to your own exacting specifications. You offer laser refractive surgery at ELZA. You had the option of purchasing any excimer laser on the market. So what were you looking for in a laser?
That's a very interesting question, Mark. Our main target is not cosmetic, but therapeutic refractive laser surgery. And having an open budget, I was free to choose any existing excimer laser platform on the market. And to be very honest, if you just perform a very standard procedure, most excimer systems on the market today do quite a comparable job. But the difference comes up when you look at unusual corneas or irregular astigmatism. And this is where I had to take a decision which platform would allow me to treat patients, for example, that have irregular astigmatism due to scar formation after trauma, keratoconus patients after cross-linking, etc. And this is where I consciously opted for the Amorous platform.
Okay, so what treatments do you offer with the SCHWIND AMARIS 1050 RS?
I do a lot of retreatments of previously failed refractive laser surgery, for example, too small of an optical zone. These are patients from the early days even of PRK who come to see us, who had a PRK for high myopia 10, 15 years ago. But there are also recent patients that for some reasons received decentered ablations, and we have to recenter the whole ablation and bring it into the middle, enlarge the zone. And then the interesting patients for me are patients with scars, could be scars after severe infection and irregular astigmatism. And my most beloved baby, of course, is all sorts of keratoconus-related irregular astigmatism, where we stabilize the cornea first, wait, and then try to assess the visual problems.
So what is it like to use as a surgeon?
I like it because I love the way the platform pays attention to detail. Let's just give you some examples. The most interesting feature I like in this platform is that if I look at the whole pyramid of Cernical coefficients, other platforms force me to either switch on or switch off the aberrations. And in this type of surgery, in irregular astigmatism, it's all about tissue sparing. So I have to find strategies not to remove too much tissue, let's say in a keratoconus cornea, and still achieve an effect. So I have to play with each single aberration, and this is what the Amorous allows me to do. And in fact, this was the selling point to me. I could play with the entire Cernical pyramid until I have a good compromise between increase in visual acuity or quality and not too much of tissue removal.
So it delivers excellence?
In my eyes, it does. Yeah, it is, in my eyes, the best platform on the market for irregular astigmatism, for unusual corneas.
So these are challenging patients, but what do they think about the results?
These patients are challenging on one hand, and they are very different from the normal cosmetic patient coming in. And as in every procedure, it's a lot about discussing the potential result with the patient. And in this type of therapeutic refractive laser surgery, the aim is not to get rid of glasses. The aim is rather to gain lines with glasses.
Sure.
Because many of these patients come in and see 20/40, 20/63 with the best correction. And their aim is to have a better quality of life still wearing glasses. And so we explain to them that it's a long process they go through, and they might require not only one, but 2 or 3 laser surgeries before they get to the result.
Okay. Have you used the Amorous platform's transepithelial treatment modality, trans-PRK?
Yes, and I'm happy with the results. So I was reluctant to rely on a nomogram for epithelial thickness in a population of which I know nobody has the same epithelial thickness. But once I started, I was really happy with the results. So if you have a virgin cornea that has never been operated before, then the nomogram that is behind the epithelial ablation apparently is so precise that my patients have really good results and the target is achieved in a high percentage. So I I perform almost exclusively trans-PRK now, except for specific corneas where a mechanical abrasure would be a strategic advantage.
So how does it compare with LASIK in terms of speed, efficacy and safety?
LASIK is a procedure that introduces an additional step, right? Sure. You create a flap, and whenever you do something additional, you might have complications related to the additional steps. And PRK or trans-PRK is certainly, at least in my hands, I prefer it to LASIK because I see less of a complication rate. You have an open surface, but everybody nowadays knows how to deal with an open surface. And with regard to speed of the closure, the recently introduced Smart Pulse technology gives us a much smoother surface. I will probably also switch from unilateral PRK to bilateral PRK because the speed of closure is much faster and the increase in visual acuity is also much faster.
Okay. So is there a particular group of patients that might benefit from trans-PRK?
I think all patients might benefit if they fall into the inclusion criteria. And if I have the slightest doubt about the biomechanics of the cornea, I very easily do the transition from recommending a LASIK, bilateral femto-LASIK to a bilateral trans-PRK.
Okay. So what has been your experience with the Amorous for treating presbyopes?
I have relatively little experience as per now. I have treated a few patients last year with good results, but as we all know, pre-op patient selection is so essential to this type of treatment. So you can have fantastic results. Few patients I've treated were happy, but again, I think it was a good selection of patients. I like the science behind the overall concept, combining micromonovision with a certain multifocality of the cornea. So I appreciate and understand the scientific reasoning behind it, and I will intensify now my presbyopic treatments in the next months to see the outcomes.
So the ones that you've done, the outcomes have been good, but what have the recovery times been like?
The recovery times were fast. I've exclusively done femto-LASIK procedures combined with this presbyopic approach, and the recovery was very fast.
So what do you think about the overall performance of the Amorous platform?
I like working with this platform because it offers me both worlds. I can use it as a standard working horse for the daily -3 diopter sphere patient coming in, but I also can highly customize it to meet the needs of a subgroup of patients that is very special and very demanding also.
It goes without saying that you're a world-renowned surgeon and a leading figure in corneal cross-linking. When we've published articles on your work, it's often accompanied by a photograph of you performing the procedure, and the instrument in that photograph is a Schwinn CXL 365 Vario. So are you happy with that?
I like the Vario because it offers me versatility. It has a decent irradiation profile, and it gives me the option of using different fluences. We all know that certain of these fluences are not yet clinically validated for keratoconus, but the Vario offers 3, 9, and 18 milliwatts, and we know now that 9 milliwatts seem to work really nicely clinically, so I switched from 3 to 9, which reduces my surgical time from 30 to 10 minutes. And I have the option of using 18 milliwatts, which we also do, for example, in the treatment of infectious keratitis.
But of course, the ELZA Institute is not just about treating patients, it's a world-class research institute too. So I've seen a few papers of yours where you've used an Amorous 750S for research work.
Yeah.
What's it like using the Amorous for that purpose?
That's my passion. I'm a surgeon, but also deeply involved in cell biology. So one thing we were looking at is how can we improve the results, the surgical outcomes in keratoconus patients with irregular astigmatism. And the idea was to first stabilize these corneas with cross-linking, and then do not perform a PRK in the same session, but rather wait until the cornea's reaction to the cross-linking is stable, which might take 12 months or even 24 months. So it's a two-step procedure. And then in a second step, perform a wavefront-guided PRK, looking at the Zernike pyramid, deciding how much tissue can be sacrificed for the better outcome. And to do so, one important element was missing, which is how much do we ablate, how much does an excimer laser pulse ablate in a cornea that has been cross-linked before? Because there are additional covalent bonds introduced into the tissue. So do we need the same energy? Do we need 20% more, 30% more, 10% less? And to investigate this, we went back to the lab and lasered some hundreds of porcine corneas. And interestingly, the number is almost the same throughout the entire corneal depth. It's 12% more energy, which means that if I want to correct 1 diopter in a cross-linked keratoconus cornea, I have to correct 1.12 diopters. And that's just an additional level of precision we can add into the software. But Schwinn is planning to introduce this concept into one of the future software updates.
You could have performed this research with any laser platform. What made the Amorous platform particularly useful? Why did you choose it?
I could have done this research with any type of excimer laser platform, but to be honest, no other excimer laser platform was open to investigate these issues. And this is one of the reasons I like to work with this particular excimer laser platform, because the techniques is one thing, the team behind the techniques is another. And I like the Schwinn family because they are open to innovation, they are open to incorporate unusual approaches to the field.
So what is it like working with the people at Schwinn?
What I like about working with them is that they are very responsive. If I have, for example, a very special patient that gives me a challenging topography and I would like to have the input of the engineers of Schwinn, I have a very direct and open communication with them, and they are very responsive, so I get my responses quickly.
You talked earlier about them being a family company. Is that important to you?
Yes and no. It's not the fact per se that it is a family company, but it is a company that is completely dedicated to one product. And the size of this company allows them to be extremely fast in their responses. So it is not a super tanker that needs half a year to get back to you when you have any type of innovative input to give, but they react within hours to days. And this is something I really appreciate in this company.
So application development then is much easier than with a company that's as nimble as Schwinn then?
Exactly, yeah.
So that they're very receptive to your feedback?
And this is what I like. They are very open to any type of constructive criticism, even if it would be to the disadvantage of the system, because their response simply was, well, if you think that this would be worthwhile investigating, and even if it would be a negative result for us, well, we take it as an opportunity to make our platform better. And this is what I'm looking for.
Excellent. So you're happy with your purchase?
I'm happy with it.
Hafezi, thank you very much.
Thank you.
Cheers.